Assalamu alaikum and good afternoon from Malaysia. Welcome to 23rd monthly MedEd webinar on standard setting in medical education. The learning outcomes of this session include the participants will be able to explain the concept of standard setting, explain the rationale for use of standard setting, discuss different methods of standard setting, implement standard setting processes in their institutions. We will go into the detail of this learning outcome, including the staff development and the processes, set standards for assessment in their institutions, and improve assessment standards in their institutions. Here is an example of grading system in different countries. The grade names in Australia include high distinction, distinction, credit, pass, and fail. The equivalent US grades include A+, A, B, C, and F. And UK equivalents are first class, second class upper division, second class lower division, third class, and fail. The question is how these grades were decided, how the marks were given to these grades, especially the category of pass and fail. Who decided that the pass mark should be 50%? When was it decided? Why was it decided? What was the criteria used for it? How to decide which student has failed, is borderline, minimally competent, or has passed the examination? How to arrive at a pass mark? In multiple choice questions examination, a student can score 20 or 25% marks by chance. Should it be added to the 50%? That is, should the pass marks be 70 or 75%? A glance through the history of grading system answers some of these questions. The ancient Greeks used assessment for formative purposes and not as evaluative learning tools. Harvard required exit exams in 1646, that is around 400 years ago, to attain a degree. The first college grading scale appeared in 1785 when Yale created a grade scale of 4 descriptive adjectives. That is the best, the second best, the low, and the lowest. Over the next century, Yale refined its grading systems to numerical points measured from 0 to 4. When a 2 number was given as a passing mark, that means the 50% passing mark. The rationale and concept of standard setting. We need a meaningful and essential performance criteria designed to provide evidence that candidates have successfully completed the task. Test developers need an educational tool by which they determine the cutoff point on the scoring scale that separates the non-competent from the competent. The traditional approaches in defining such a cutoff score corresponding to 50% or 70% correct answers to the items do not provide robust and valid evidence for pass-fail decisions. Standard setting is a process to distinguish between a competent student and an incompetent student by determining the score associated with the minimal level of skill or knowledge required to reach a certain level of achievement or the cutoff mark. Based on the criteria, the candidates may be placed into a greater number of achievement levels. For example, clear fail, borderline, pass, good pass, excellent, or distinction. Therefore, standard setting is a crucial part of quality assurance. If the cutoff score is incorrect, the exam results will be affected, which could have huge implications. Standard setting helps to determine minimal level of acceptable competence to declare a student successful in a particular examination, that is just pass. The minimal acceptable level may be different in different examinations or component of examinations. For example, the minimal acceptable level may be different in different OSCE stations, depending on the nature and importance of the area being assessed. The minimal acceptable level at a cardiopulmonary resuscitation would be very, very different than a minimal acceptable level at a station where abdominal examination is being assessed. A number of standard setting approaches are currently available, both for written and performance tests, some more appropriate than others for different types of assessment. Therefore, one standard setting method may not be appropriate for different types of assessments. This webinar will focus in detail on three commonly used approaches: the modified Angoff, borderline regression, and Nedelsky's method as examples and guide for a standard setting framework. The standard setting methods can be divided into two categories: norm referenced or relative, and criterion referenced or absolute. Let me explain these two categories in a bit more detail. Norm referenced are methods that are used to calculate cutoff marks where the number of passing candidates is relative to the rest of the candidates taking the exam. For example, the worst performing 25% of the candidates will fail the exam. This means in this method, the students' performance is compared within the peer group. Norm reference methods are useful in situations when there are limited number of places available, such as entrance exams or competitions. They are not widely used for high-stake examinations, as this process does not actually define how well a candidate performed in an examination. Just how that candidate performed in relation or comparison to other candidates appearing in the same examination. A relative standard can be set at the mean performance of the candidates or by defining the units of standard deviation from the mean. Percentile ranks as well as median point could also be set as norm reference standards. These standards may vary from year to year due to shifts in the ability of the group and may result in a fixed annual percentage of failing students if the scores maintain a normal distribution across different examination administrations. The weaknesses of norm reference standards include: standards are not content related. a fixed number or percentage of candidates may fail each year. Examinees' ability may influence the standard. Standard is not known in advance, and diagnostic feedback relative to performance is unclear. On the other hand, criterion referenced are absolute or standard setting methods where the cutoff mark is based on a well-defined standard as opposed to in relation to each other in the group. This means that any number of candidates could pass or fail the exam, depending on whether or not they meet the minimum defined standards for the assessment. Examples of criterion reference methods include Angoff and borderline regression methods. An absolute standard stays the same over multiple examinations relative to the content specifications of the test. The failure rate may vary due to changes in the group's ability from one examination to the other. 100% pass or 100% failure rates are possible. Now coming to methods of standard setting, they can be divided into two groups: test-centered, for example, Angoff, and examinee-centered, for example, borderline regression. The test-centered methods, the standard setters estimate the probability of a minimal competent student will answer the items correctly. That is, whether the items are difficult or easy for a minimal competent candidate. The most popular test-centered methods are the Angoff method, the Abel method, and the Nedelsky, and these are applied before the exam is conducted. Whereas the examinee-centered methods, the pass marks is based on students' actual performance on a specific assessment. Therefore, it is applied after the exam is over. In these methods, students' performances are scrutinized rather than assessment questions. The most popular test-centered methods are the median borderline method, the regression model, and the contrasting group method. Let's talk a bit more detail about the Angoff method. Angoff is a well-established method of standard setting. It's most commonly used in high-stake examinations, such as OSCE and multiple choice questions, and is most reliable when supported by another standard setting method. The Angoff method requires expert judges to discuss the issues involved in determining a pass mark and to evaluate the examination by using a well-defined and rational procedure. So there is a huge role of expert judges in application of this standard setting method. The Angoff method is based on the concept of the borderline or acceptable minimal competent candidate. This is a second most important pillar of Angoff method to decide the level of acceptable minimally competent candidate. The subject matter experts, or SMEs, are asked to evaluate each item and estimate the proportion of minimally competent examinees that would correctly answer the item. The ratings are averaged across the raters for each item and then summed to obtain a panel recommended raw cut score for the results. This cutoff score then presents the score which panel estimates as a minimal competent candidate would get. This means by averaging the score, we would get a pass or minimal pass level in that particular examination. Here is an example. There are 10 questions and there are 10 judges. Each judge for each item gives a percentage of minimally competent candidates that will answer that question correctly. For example, in question 1, the judge 1 thinks that 60% of the minimally competent students or candidates will answer that questions correctly. Whereas judge number 5 thinks that 65% of minimally competent candidates will answer that question correctly. If you go to the question 7, all the judges agree that a minimal competent candidate, 70% of them would answer that question correctly. So after getting these figures from these judges, the mean is calculated for each item. And from that, the cutoff percentage is calculated. Modified Angoff method is preferred over original method. A modification adds to the process by the provision of data about difficulty of the items. This means that a sample is taken from a previous exam or from a trial exam, and the results are provided to the subject experts while they are deciding the minimal acceptable pass level. The Angoff methods depends on the SME's degree of familiarity with the minimally competent test taker, that is the hypothetically borderline group, who is neither qualified nor unqualified to pass the test. This task is highly dependent on the capacity of SME to understand the meaning of a borderline minimal competent candidate's characteristics. This is a subject to decision biases, such as the overconfidence bias, or a lot of subjectivity appears in this method. The SME has to understand how the minimally competent candidate will respond to the required performance task. The SME must also be familiar with the expected level of examinee performance as defined by the purpose of the test. Whether purpose is to assess the level of expert versus beginner and be able to understand the degree of difficulty of the task. Therefore, a modified Angoff method is a test-centered method, is a criterion referenced, relies on SME's judgments, requires understanding of minimally competent students' characteristics. Actual performance data are provided to SMEs as an additional information source, which help them to decide the level which is our minimal level, which is acceptable to just declare pass for a particular candidate. The steps of Angoff method. The first step is to select and train subject matter experts. This is a huge task and very important task, and I'll go into a bit detail of this in a short while. Second, to define a minimal competent or borderline candidate, again an important step to define or to visualize a borderline candidate, what kind of characteristics are required to define a minimal competent candidate. Then first they will read a few example items and discuss among each other so that everybody can recognize or can agree to a certain level. After that, all the items would be rated. And then the items where there is a poor agreement among the SMEs, they would be discussed again to arrive at a consensus and to increase the inter-rater reliability. And after this agreement, a second round of rating would be conducted on the poorly agreement items. Based on that, the cutoff score will be calculated, and then each item, the percentage of candidates are minimally competent candidates that would answer that question correctly would be estimated. And then the Buke compromise is implemented. Buke compromise means that a passing score that is viewed as appropriate, both with respect to absolute as well as relative standards. That means a score or a result which make sense. Now, implementing the standard setting methods in institutions will go through the process of standard setting based on the steps and the staff training, including how to calculate the Angoff score. First is selection of subject matter expert. It's, as I mentioned earlier, it's the most important step to create a defensible standard setting process. Hambleton describes a defensible process as one which is based on, number one, selection of appropriate SMEs, excellent SME training, a well-defined or well-planned systematic standard setting process, which provides ample opportunities for discussion and deliberation among SMEs. The discussion and deliberations among the SMEs to iron out the differences is the major component in the training of SMEs. The reliability of the performance standards will be reflected by the degree of agreement among SMEs. A reasonable performance standard will coincide with expectations about the specified personal performance, that is, it will make a sense based on the experiences. The criteria for selection of SMEs include, number one, that the expert should be in the related field. Expert must be familiar with the examination method, should be a good problem solver, should be familiar with the level of candidates, and should be interested in education, preferably medical teachers. Here is an example of an SME for a 4th year OSCE for progression to 5th year. The SME must be familiar with the performance of 4th year students. The SME must be familiar with the process and conduct of OSCE. He or she should have experience as a clinical teacher and should have knowledge about the next phase of training, that is the year 5, where the student is going to join after passing this exam. In addition, an adequate mix of gender, age, seniority, academic versus community experiences, and the other relative attributes will further establish the defensibility of standard setting process. Means that there should be adequate diversity and mix of different levels of experts in the group. How many SMEs? Although the exact number of SMEs required is still controversial, and studies have yielded results as low as 5 and as high as 20, most suggestions revolve around a group of 10 judges as a suitable for this purpose, which still appears a very big number and sometimes may not be possible to find such people. Now, it is very important to train the SMEs so that we can get a defensible standard of the pass marks. The first step is that the facilitator or the trainer would present to SMEs a general overview of the OSCE test, for example, the duration of each station, test components, scoring methods, and any other information from which the panelists may benefit. Central to the orientation section is a statement regarding the purpose of the test. For an OSCE, the purpose may read as follows. The graduates of this medical school should demonstrate minimal competence in history taking, physical examination, and doctor-patient communication for the purpose of entering as a house officer training program in Malaysia. The purpose statement may help SMEs to choose either conjunctive or compensatory approach. The minimally competent concept and the continuing supervised training may, for example, direct panelists to consider conjunctive versus compensatory standards. Knowing that candidates are expected to continue with their training in a supervised mode and that poor performance in some areas will be further developed in the next phase of training allows a compensatory approach where all the marks from all the stations are added together to come to a final score. This means that one station can compensate the score of another station. Alternatively, they may consider that basic minimal competence in each component is essential for better future practice, and thus a conjunctive approach is warranted, means that students must pass each station individually. So these approaches may differ, for example, in the case of house officer who has still to undergo training versus a medical officer who would be working independently. The second step in training of SMEs is that they should go through the documents such as instructions to the candidate, for example, on history taking, physical examination or counseling. Instructions to the patients are standardized patients, the marking schemes. SMEs identify the minimum pointers the candidate should demonstrate for passing a station. Third step, full description of the station, checklist for history taking, physical examination or counseling skills. Then videotapes of one low performer and one high performer in the practice stations. So this is an important step again in the training of SMEs. The panelists will mark the two performers while viewing the video. And once they have marked, then the actual score will be presented to the panelists so that they can compare their marks with the actual score before they decide the minimal competence level. Here is an example of a scoring scheme of a counseling session. It has been divided into three major sections: introduction, counseling technique, and communication skills. The marks are given for each category. For example, in introduction, whether the candidate would greet the patient and introduce himself or herself. In counseling technique, whether the candidate would inform the patient about the purpose of meeting, and then whether he or she would be able to provide necessary information to the patient. Now, the SMEs under training are provided such a marking scheme, and by looking at certain videos, they would mark the candidate and then compare with each other. And after that, with discussion, they may come up to a consensus statements which they think a minimally competent candidate will fulfill. In this way, if you see, out of total score of 15, a minimal competent candidate would be required to achieve 9 out of these 15 marks. The fourth step is to set a criteria for an acceptable MMC, a minimally competent candidate, which we just saw in the last slide. Then visualize a person with minimum criteria, knowledge, skills, and attitude. And once we have an idea of a minimally competent candidate, and then imagine there are 100 such candidates. And for each item, whether it's a multiple choice question or an OSCE, what percentage of minimally competent candidates will pass that question? So, number one, you decide the level of minimally competent candidate, and then you decide what percentage of such candidates would answer a particular question or a statement correctly. And this is done question by question. Determine how many of these 100 candidates will answer the question correctly. 60, 50, 75, 85. Each SME gives his or her number for each item. Then get an average for each item and then average of all the averages to get the pass marks. Things to consider during this process: what concept is being tested? Is it a difficult concept to understand or grasp? Is it a general concept that everyone will know or be familiar with? Is the question straightforward? Are there common misconceptions or mistakes that might be made by someone at the entry level? If you do not know the correct answer, neither will the minimally qualified candidate will do. Important point here is to decide what a minimal competent candidate will know, not what should know. If we go by should know, then the criteria would be very haywire. Ratings for each question should range from 25, that is minimum 25, 1/4 of a chance, to 95, as it is unusual for that all minimally competent candidates will give the right answer. Lower ratings indicate more difficult items, while high ratings indicate easier items. Giving high or low ratings to items will raise or lower the passing score. Now, it is important to identify a minimally competent candidate. What are the characteristics and expectations from a minimally competent candidate? Before making the judgment, the experts must agree on the definition of a minimally competent candidate. All judges must have the same definition of a minimally competent candidate for the Angoff cutoff score to be reliable. The panelists must have an understanding about the level and characteristics of a minimally competent candidate. For this purpose, there should be a formal discussion among them. The criteria of a minimally competent candidate may differ in between two OSCE stations. Panelists may write independently the characteristics of a minimally competent group for every skill component. The panelists' statements are then posted and the facilitator discusses the panelists with the panelists each statement to arrive at a consensus. Arguments and disagreements are clarified and the group reaches a consensus as to what would be an appropriate list of characteristics of a minimally competent candidate per skill component. This process is essential to facilitate further the estimates and judgments of the panelists and to support the defensibility of the process. Here is one example, the rubrics defining the characteristics of different categories from distinction, good pass, pass to borderline fail, and clear fail. In distinction, all important clinical information is correctly provided. Candidate demonstrates in-depth understanding of the topic. Candidate acknowledges clinical uncertainties where appropriate. The SMEs have to agree with the characteristics of a borderline fail candidate. And the characteristics described here is that the candidates provides some important clinical information incorrectly and demonstrates partial understanding of the topic as compared to a clear fail candidate who provides incorrect clinical information and demonstrates little or no understanding of the topic. The point here is to differentiate between a borderline fail and a clear fail candidate. Here is another example. A clear fail candidate is defined as disorganized and non-confident and a wrong approach, whereas borderline is either disorganized or not confident or not right approach. So after having decided about the minimal levels, minimal acceptable levels are a borderline candidate, then next step is to calculate the Angoff score. The first question is, what percentage of minimally competent candidates would answer this item correctly? Each expert's judgment for an item should be the same or within a close defined range. Around difference could be around up to 10%. The mean of every judgment is calculated for each item. This is often referred to as predicted difficulty. Each predicted difficulty or mean is added together and divided by the total number of items in the exam to get the cutoff percentage mark. This percentage of total marks for that examination indicates the cutoff score or cutoff mark. Here is the example. You have seen this table before. There are 10 questions, there are 10 judges, and each judge has given a percentage of minimally competent candidate who would answer that questions correctly, and we have the mean in this last column. The next step would be to add up all these numbers and divide it by number of items, and that would give the cutoff percentage score. If this comes in decimals, that can be rounded to the nearest figure. So that completes our discussion on the Angoff method. Let's move on to the second method, which is borderline regression method. Borderline regression is an absolute examinee-centered standard setting method that is widely used to standard set OSCE exams. The actual marks that all candidates scored for a station is plotted on a graph against the global rating they were awarded at the station, and a best fit line or trend line is drawn. Here is the example which you have seen before as well. So you can see that apart from the scores, there is a global rating given below, and the examinee is given a global rating by the examiner, apart from giving marks according to the sheet. In borderline regression methods, therefore, the candidate's performance on stations or cases is scored in two different ways: holistically by a global grade, and also with the checklist or domain-based scoring instrument. The checklist score is regressed on the global grade, and the station level standard is set after the examination using the regression model. The exam level standard is then based on the aggregate of the station level cut scores, with the option to employ additional conjunctive level standards, such as the use of the standard error or of measurement. Here is an example. We see the marks, the station marks, and we see the global rating. So the global rating is plotted against the station marks, and a cutoff point is identified at the borderline level. Here is another example. Here, if you see in this example, the cutoff mark would be nearly about nearly 40%. So in this way, by plotting the actually gained or obtained marks against the global standard and finding a cutoff mark for a borderline candidate gives us a criteria for that particular station. Please remember that mark is only for that particular station. Now let's move on to the third method, which is Nedelsky's method. Nedelsky's method is item-centered. In this, SMEs make decisions on a question-by-question basis regarding which of the question distractors they feel minimally competent candidates would be able to eliminate as incorrect. This means that when they look at the question and the different statements, including the key and the distractors, so the SMEs decide that which of the distractors a minimally competent candidate would identify before answering the question. The minimal pass level for the item is computed as 1 divided by the number of distractor or options remaining after the incorrect options are removed. The minimal pass level is then summed over all the items in the test to produce a passing score for the total test. For example, on a 5-option item, if a SME decides that the minimal competent examinee will recognize correctly 2 options as being incorrect, the minimal pass level of this item will be 1/3 since 3 options remain after the 2 incorrect options were removed. That is, out of 5 options, the SME thinks that student will be able to identify correctly 2 distractors. So the candidate is left with 3 options to choose from. If the question has 4 options and a minimally competent student could be expected to rule 2 out of these 4, this leaves the student with 2 answers to choose from. The Nedelsky's rating for this case would be 1/2 or 0.5. Let's look at the real paper. There are 10 items. There are 4 options in each item. The correct item or key is indicated by an asterisk. So if we look at the item 1, the SMEs decide that the minimally competent candidate would be able to identify correctly A as distractor, and then the candidate has to choose 1 out of the 3 left. Therefore, the estimated passing probability would be 0.33. On the other hand, if you look at the item 2, a minimally competent candidate is expected to identify 2 distractors correctly. This means that he or she is left with 2 options to choose from, and therefore the estimated passing probability is 0.5. In this way, for each item, the estimated passing probability is calculated and totaled to get the cut score or cutoff mark. If you look at this table, there are 15 items. There are 6 SMEs or assessors, and each one gives a Nedelsky value. For example, for item 1, the first assessor gives 0.33, second and third assessor give 0.5 each. Similarly, the 4th, 5th, and 6th assessors or SME gives 0.3, and therefore we can calculate a mean of 0.39. Similarly, the mean is calculated for each item, and then a total score is calculated. Advantages of Nedelsky's method include that it is a transparent method, it is simple, it is feasible, but however, there are some limitations for this method. It can be used only for multiple choice questions. There is a lot of subjectivity involved because decision making about the probability of a correct answer by a minimally competent candidate is subjective. It assumes that the test takers answer MCQs by eliminating the options or distractors that they think are incorrect first, before guessing randomly the right answer. However, the test takers may not follow that strategy. Raters tend not to assign probabilities of 1, that is, to judge that a minimal competent candidate could rule out all incorrect responses of options. it is assumed that they can only guess among the remaining options. This tends to create a downward bias in item ratings, that is, a rating of 0.5 is assigned instead of 1, with the overall result being a somewhat lower passing score. This methods therefore tends to produce lower cut scores than other methods and therefore is likely to increase the number of false positives. Looking at the limitations of standard setting methods as a whole, all standard setting methods involve expert judgmental decisions at some level, which involves a subjective nature of standard setting. All standard setting methods also have to identify a minimal competent subject or student, again, a subjective nature of standard setting. Variability in standard setting results in different centers or at different times will be found. The most popular test center methods are the Angoff method or its modifications, the Abel method, and the Nedelsky's method. These methods have been criticized for two reasons. First, it is very difficult for standard setters to imagine the knowledge and skill levels of minimally competent candidates in order to estimate the probability that they answer an item correctly. Secondly, if standard setters are changed, the pass marks will change. With that, I complete this presentation and will be happy to answer if you have any questions. Thank you very much for your attention. All right. Thank you very much for your attention again. Let us start by answering some questions which were written in the chat box. The first question was that how frequently Angoff is done. Of course, we have to do it for every examination. But once we are used to it, and we have done few times, then it doesn't bother too much and can be done very quickly. Second question is a bit more detail of Buke compromise. Actually, Buke compromise is that once you have got a result, you would see that whether it is close to your expectations. Means that it is not way beyond what you would have thought about that group of students. For example, you think that the result would be around 60%, but it turns out to be 20%. This means that you have to look at the not only the conjunctive method, but also the compensatory method, are also not only at the norm referenced, but as an overall impression as well. So that is the compromise, that this is in a way to check back at the usefulness of the standard method which you have used. The third question was that examiners forget global rating. I don't think we can do anything about that, if except that we keep on emphasizing the examiners that they should give the global rating. The second part of that question is that the data is non-linear, are not scattered. Actually, that indicates a good agreement among the examiners. Anyway, we still have to draw a trend line on that data, and that trend line has to be based on the borderline group to give us that mark. Right. I would welcome any other question from the audience?
Assalamu alaikum, Prof. This is I have two questions. Number one,
right.
What is the purpose of standard? Sorry. What is the purpose?
Prof. Kabir, can say it again. Your voice is breaking. Yes, can say it again, please.
What is the purpose of this standardization? This standard setting. What is the purpose? Is it to make the exam standardized, or is it for helping or friendly for the minimally competent students? Number one.
Right.
Number two is the pre-standard setting, pre-exam in some entry exam, like our country, Bangladesh College of Physician and Surgeon. Then if one can get the 60% mark in 3 papers, he or she will be eligible for this entrance, pass the entrance. Sometimes during my time, in one time, in medicine topic, nobody could achieve the 60%. Nobody could achieve that. The pre-exam standard setting was if there is 3 papers and average 3 papers, if there is 60%.
Prof. Kabir, your voice is very breaking. Yeah, but I think I have understood the question. Now, the second question first, that the 60% in three papers. But here question is, how did you decide the 60%? How do you arrive to the figure of 60%? And that is the purpose of standard setting. And the first question is related to that if you say 50% mark, how did you come to that figure? How do you defend that percentage? So the purpose of standard setting is that the pass mark may not be exactly 50%, maybe 40% or 55 or 60, but you can defend that because you have gone through a process to arrive that figure. So basically it is in a way trying to be fair and trying to be transparent and quality assurance for deciding a pass mark. That is the purpose. Right, Muhammad Abid, please unmute yourself.
Sir, the first question, can you hear me now? I just changed that. In the first question was, what is the purpose of standard setting? Is it to make the exam standardized, or it is for helping the minimally competent? Or
no, it is to be fair to all the students, and to be able to give the criteria. How did you arrive that this student should pass? Now, if we have a 50%, I don't know how do we arrive at 50%. Why did we decide 50%? But standard setting method would give you the reasons that why did you arrive at a certain number, which could be 50 or more or less than 50, so that it gives you material to defend your passing mark.
Thank you.
Yes, sorry, Muhammad Abid. Yes.
Right. So thank you very much, Dr. Malik. It's very interesting, your talk, and it's a very important topic, especially the schools who are struggling to set up the standard setting methods, etc. So I'm not sure your medical school or medical college how long you've been running this program, but certainly the place where I work in, the College of Medicine and Health Sciences in the UAE. So we have been running modified Angoff method and borderline regression for the last 10 years or so. And our experience in the last 10 years is that it's always been very difficult to engage and recruit, the trainers, and the way the whole process is managed. So we've been thinking about the other couple of methods. I think you already touched on the Cohen method and the bookmark method. So we are thinking of those, Ideally, the modified Angoff is the brilliant method, but if it's done properly, when we have enough number of the trainers, if we train them, and the whole process is done thoroughly, then it works very well. But many schools, colleges, they struggle with it, like one of our medical school is struggling with it. So we are thinking of some other alternatives who may not be that laborious, have not that laborious to do. So I don't know what your thoughts would be on this issue. Thank you very much.
Sir, I fully agree with you. I fully agree with you. It's not easy, and it's laborious. It's time consuming, definitely. But is my the only thing which gives some courage here is that once you have trained those people and they are still with you, so the next time it may not be that difficult. So if the staff is still there, but if you have to do it to train them every time, of course, you are absolutely right. It's not that easy. Having said that, I still feel that this is really something which is worthwhile. As the standard you get is it's a lot of satisfaction at the end of the day. You get that the decisions you are making are really reasonable decisions, and of course it's very, very important because you are deciding the future of a person. And if you feel satisfied with your decision, I think that's the best thing about it, and that's the worth it. But I fully agree with you. The effort needed is tremendous.
I mean, thank you very much. I think we were considering at the moment, the Cohen method for the MCQs and the bookmark method for the OSCE thing, So we've been having discussion because this is a big, not the problem, but it's very, very concerning that although we have these standard setting methods, but we're not doing it competently, and then giving justice to these methods.
I think again there's no point in aiming for so high, but it's not feasible.
Yeah.
That defeats the whole purpose. So of course we need to see the feasibility first before embarking on such effort. And I think you have a lot of experience, actually more than what I have in this area, and I do tend to agree with your suggestion.
Thank you very much. Thank you.
Right, next, Dr. Arif Mo, please unmute yourself.
Yes, Assalamu alaikum.
Wa alaikum assalam.
Thank you very much. First of all, I have some internet problem today, so excuse me if the question is already addressed. My query is this, that when we talk about the difficulty index and the discrimination index, here in different institutions, we have a different merit level of the student. For example, in one college, the difference between the upper merit and lower merit students is less, while in other college, the difference between the upper merit and lower merit student is more. So is that discrepancy addressed by standard setting?
Right. Now, the first thing is that this standard setting is not something universal. It would be different in different institutions because it reflects your population and the level of your students. So even it's not applicable from one exam to another because the situations change. So I don't think we can compare one institution with another. You have to have based on your own population of students and the estimation by your own standard subject matter experts. So it is very, very individualized, very, very individualized. unless you have an institution, for example, a university which conducts exam for maybe another 5 or 6 medical schools, then it would be applicable to all the medical schools who are taking exam under that university, so that university can have their own standards. But otherwise, if it is an individual medical school, it has to be different for every medical school.
Okay, thank you.
Right. Nazar, Dr. Nazar, please unmute yourself.
Hello, sir. Thank you for your nice presentation. I have a question which is composed of 2 parts. Regarding the Angoff method, if we do it for the written test, in our institution, we have a comprehensive written exam that for the final year, for final graduation year, that include the obstetric, pediatric, surgery, and medicine. So the subject expert should be composed of all these parts. Do you advise to do it as a one meeting that contains 7 or 8 experts from all these disciplines or not?
All right. Okay. Thank you for that question. It would be nice to have at least 1 or 2 representatives from each discipline. Having said that, on the other hand, when we are talking about an undergraduate medical examination, especially, generally the lecturers from different disciplines, they are expected to have sufficient knowledge about other disciplines as well. So and then of course, because there is a discussion, the major component in Angoff method is the discussion and deliberation among the subject matter experts, and that is very helpful. So my feeling is that even if you do not have one, let's say, a subject expert from one discipline, still it would be valid if the consensus is arrived among all other disciplines. But having said that, as I mentioned, it would be nice to have at least some representative from each discipline.
So the second part of my question, how much time from your experience is required to do an Angoff for 120 MCQ test, written test?
Actually, if we have trained well, and that training needs to be done only once, then it shouldn't take long, because mostly there would be agreement. Very few items would be where there would be the poor agreement and would need some discussion. So although it seems that you have to, let's say, there are 100 questions and there are 4 components or 4 statements in each, so you have to go through 400. But what would happen actually is that a great majority, there would be agreement among the experts, and you don't need to discuss about that. So only few statements where difference is more than 10%, you might have to discuss. So it seems manageable in that way. The only condition is that the subject experts are the members are properly trained.
And sorry for asking too many questions, but do you advise to supply the correct answer to the experts, as they are from different disciplines? They might not be so familiar with each discipline.
We use the correct answer during the training. The answers from the previous batches are are used while we are training in the modified Angoff.
So my question is, sorry, I might not express it well. For example, I have 120 MCQ,
right.
but 10 of them is about the pediatric. I am expert in the pediatric. I know the correct answer, but I might not be sure about the correct answer of the medicine question or of the surgery question. Do we, as a medical education department, we supply the correct answer for the experts, and they decide whether the minimally competent student can answer this one or not?
No, but for that, you don't need to have correct answers. You are estimating a minimally competent candidate. Let's say I look at a question, and if you see the one statement was that if you do not know the answer to that question, then obviously the minimally competent candidate would not know as well. So if you do not know the answer to that question, then your estimation would be very low for that.
Okay, thank you very much, sir.
Right, Dr. Laikuzaman, please unmute yourself.
Assalamu alaikum warahmatullah. Thanks,
Assalam.
Professor Malik. Wonderful, very comprehensive presentation indeed. Jazakallah ta'ala bil khair. Now I have two questions. I had only one question to start with, but with the last question, I have one more question. Anyways,
right.
About the minimally competent candidate, I'm wondering that in a good teaching training institute with the resulting, of course, good performer, the minimally competent student would be at a different level compared to a place where the teaching and training is not so well, and of course, therefore, the performers will not be performing too well. I would be very worried about the community where these students will be going, these professionals will be going. And that is also worrying me. How will they stand in the international community? And how will we say that, yes, they are up to the mark? Any comments on that, please?
Right now, I mean, the situation you are telling is that you are comparing one institution where supposedly the students are very good and other institutions where students are not so good. So what would you do if you are not doing standard setting? Still, you are using the same passing mark, right? But are you using the same exam questions in two institutions?
Oh, I'm sorry, probably I couldn't put the question very, very clearly. My question is because we are following the minimal competence approach.
Right.
My teachers, my examiners who are sitting there, they know that how well performing their students are, and therefore they would say that, okay, because my student is not going to be so well performing, therefore my will be much lower. If the teaching training was not good, and for the performance that is expected is also not good, so they would say that, well, my cutoff would be lower. If I had done the same exercise in a better performing situation, the cutoff would be higher. So when they go, both of them go into the international community or a third place, then their performances would differ. And my worry would be about the community where a poorly performing and poorly assessed student would be going, or the professional would be going at the end of the day. Am I making my question clear, by the way?
Okay, no, thank you very much. Yeah, I understand that. But here the statement is minimal acceptable level. We are not saying minimal level. We are saying minimal acceptable level of competence. So the minimal level of competence does not should not be affected by the level of students, because you have decided that to be able to pass that examination, a minimum criteria which has been well defined should be applied. I think Muhammad Abid might want to say something about it. Please unmute yourself.
Right, so thank you very much. It's a very interesting question, Dr. Lai. So I think that what I would like to say is we need to maybe think back that what this standard setting process is. So we need to go back to our medical students and the curriculum, because that what are contents of our curriculum and how we are teaching them. So the standard setting process is about assessing whatever is in the curriculum and whatever we have taught them. So the standard setting process need to consider all those aspects as well, not just what is agreed within the standard process. So I think there should be some overall the coordination of what we expect from the students when they qualify as a doctor. So qualifications are one thing, but the second thing is your foundation training. So you're not just going to go to practice without having a reach at the minimum level of your education and training. I mean, certainly the undergraduate training try to deliver that. So I think that's very important from that point of view, that we must make sure that our curriculum is broad-based and we teach them to our students, and then comes to the assessing those students through this process. Thank you very much.
Thank you. Thank you very much, Dr. Abid, for your help in answering this difficult question.
That's a compliment for me.
Yeah.
Thank you very much. Thank you.
Any other questions? If none, thank you very much, everybody, for your attention and support. I have 2 slides to share before we conclude this session. The usual slides we share. How to go back? Basic. Okay. All right. So the first is the announcement for the next webinar, which would be on 27th of March, and it is about the learning environment. And Dr. Rukhsana Hussain Malik would be presenting. The time would be the same as today's. The second is our usual appeal and request, and to the participants, please donate $1 USD or equivalent amount in your currency to any deserving individual in your neighborhood or to any welfare organization in your community after attending this webinar. So you might think that is the fee you are paying for attending this webinar. Please follow this request. Thank you very much, everybody, for your attendance, and we'll see you in next webinar, inshallah.
Thank you very much. Thank you.